Hello, my name's Nicole and I'm going to show you what I would do if my baby had an ear infection or a head cold. This is stuff that I've learnt in my training as a Bowen therapist. So here's Ruby. So the first thing I'm going to do is to find Ruby's collarbone. So can you tilt your head backwards so I can see your bones? So you can feel the collarbone there, and there's a little bump there, and the collarbone goes along here, and I'm going to make little moves along the top of her collarbone, the neck side of her collarbone, and little moves along the other side of the collarbone. So what this is, it's a lymphatic drainage technique, and doing this opens up the main drain into the thoracic duct of the lymphatic system. So any snotty stuff that the head or the ears wants to get rid of, we're opening it up and we're opening up that main drain. So now we're going to find the muscle. So there's the corner of the collarbone, there's two little bumps here, and there's a muscle that leads from the bump to another bump behind the ear. And this is called the sternocleidomastoid muscle. So we're going to be working with that muscle because it's called a milking of the sternocleidomastoid, and that helps to take fluids out through the nose and through the eustachian tubes of the ears, so that if Ruby had an ear infection, this would help to get rid of it. So I want to feel around until I could feel that muscle, and I want to sort of pinch the muscle, pull it out sideways. Oh, I might have gone a bit hard. So you want to go as hard as you can go without causing pain. So I'm just going to go lighter and lighter every time until I get to a point where it doesn't hurt you.
That tickles.
Oh, well, that's a bit better than hurting. And then when I get up to where it's almost to her skull, I can't actually grab a hold of it anymore because it's so close to the head. So I'm just taking one finger, bringing some skin slack over the muscle, and then pushing with a bit of force back the other way to sort of flick it or flip it. Now we're going to do the same on the other side, finding that pointy bit of bone, feeling for that muscle. Okay. And then the next thing I'll do, if Rube's had an ear infection, there's a soft little point under the ear, just behind the jaw, and so I'm touching the base of her ear at the back, and I'm just going to take the skin lightly upwards and then push in and bring with a little pressure, dragging downwards. And I'll do the same on this side, taking skin slack up lightly but then applying a little bit of pressure as I go down. And if you really had an ear infection, then this would really hurt. So maybe you're getting an ear infection. Is that side more sore? Well, if it really hurt, I would just do it lighter and lighter until it doesn't hurt. But the more you do this, the better it will drain. So, and if you had a cold, then there's other moves you could do as well. One is, if you had a sinus cold, there's a point on the cheekbones that you could push on that helps the sinuses to drain. There's a point in the eyebrows which is it's about the size of your fingertip, a little hole. That's another point that you can push on.
Your hands are ticklish.
Are they ticklish? Anyway, that's what I would do, and that might be a way to avoid using antibiotics to treat ear infections. If you can get the ear to drain, then the infection will drain away with it.